In this video, we're going to talk about the many different approaches to preventing and treating anxiety during pregnancy and postpartum. To learn more about anxiety in the perinatal period, watch part 1 of this video. Different types of treatments will be recommended depending on whether your symptoms are mild, moderate, or severe. Today we will go over some methods that have the best evidence for prevention and treatment for anxiety in pregnancy and postpartum. Lifestyle interventions that focus on changes in exercise and/or sleep may be useful to prevent and treat mild anxiety during pregnancy and postpartum. Getting 2.5 hours of moderate exercise per week has been shown to help prevent and treat mild anxiety. You should speak with your healthcare provider to discuss what lifestyle interventions might be most helpful and appropriate for you, especially during pregnancy. If you are consistently not sleeping well, you may be more likely to struggle with your mental health. Try minimizing nighttime wakings by involving your partner or another adult in overnight feedings. If you suffer from insomnia, there is very strong support for cognitive behavioral therapy for insomnia. Lifestyle interventions can also play a role in more severe cases in combination with psychotherapy and/or medication. One key risk factor for anxiety in pregnancy and postpartum is isolation and the feeling of not getting enough support. Informal interventions like receiving support through your community, family, and friends is incredibly important to preventing anxiety and can also be really important when you are receiving treatment. Not everyone has good access to informal supports from their family and community. More formal supportive interventions exist too. One example is peer support, where people who have experienced anxiety in the perinatal period are trained to provide support to people currently going through it. Another example is co-parenting education, where parents are supported to learn skills to navigate the stresses that come with new parenting. These interventions can help to prevent anxiety during pregnancy and postpartum, and on their own can be treatments for mild anxiety. They can also help in the treatment of moderate severe anxiety, but usually only in combination with psychotherapy and/or medication. While these interventions have been shown to be helpful, it is important to note that people with great support networks may still experience anxiety. Psychological interventions are what many people think of when they talk about therapy or talk therapy. There are many different kinds of talk therapy. Some common types that are known to help in the perinatal period are cognitive behavioral therapy and mindfulness-based therapies. Fear of childbirth symptoms can be helped with several forms of psychological treatment, primarily those containing elements of CBT. There is even some support for these to be delivered in a guided self-help format. Therapy sessions are most effective when attended consistently. Most therapy sessions are usually delivered weekly, last from 4 to 16 sessions, and can be delivered in person or online, individually or in a group. There are also some self-help therapy books and programs that can work. These are more effective when combined with the support of a trained coach, rather than working on them on your own. The goal of treating anxiety with medications is to significantly reduce or eliminate symptoms, as well as prevent episodes in those who are at high risk of relapse. Most medications used to treat anxiety are considered compatible with pregnancy and/or lactation. However, it is important for each person to weigh the potential benefits of a medication versus any potential side effects or safety considerations of taking the medication. If you are already taking medication, your healthcare provider may encourage you to stay on it. This is especially the case if you have suffered severe anxiety in the past and have a high chance of relapsing. Specific information about the risks and benefits of different medications for anxiety can be found in the CANMAT guideline or the accompanying patient and family guide. Finally, many people ask about complementary and alternative treatments for anxiety in the perinatal period, such as yoga, massage, or vitamins and plant extracts. The research on these types of treatments is not as strong as the research for other treatments in this video, so they are not usually recommended as the first treatment to try, nor as treatments on their own. There is some support for certain interventions in preventing and treating mild symptoms of anxiety, so they may be helpful to consider in addition to other treatments. Please speak with your healthcare provider to discuss what complementary and alternative treatments might be most helpful for you. You should continue to follow up with your healthcare provider until you recover. This is especially important if what you try first is not helping you enough and a different treatment is required. In addition to creating a treatment plan with your doctor, many of the treatments that we went over in this video can be accessed on your own, especially through online communities. People who have depression can also experience anxiety symptoms, and treating the depression can help with the anxiety symptoms as well. If you're interested in learning about treatments for depression, you can find more info in our other videos. For more information, visit canmat.org. Here you can download Seeds of Hope, which is a guide to mental health issues in the perinatal period, and access other resources related to the 2024 CAMAT guideline for perinatal mood, anxiety, and related disorders, such as community resources, symptom scales for you to fill out, and more videos in this series.